Mastitis is a common complication of lactation, and at its most basic definition is inflammation or swelling in the breast. This inflammation often starts with an unresolved plug duct, where milk has either not been moved soon enough, like from babies sleeping longer at night or not pumping enough at work, or from the wrong size pump flange or pressure on the breast that does not allow milk to move efficiently or thoroughly from the breast. Mastitis may happen with increased maternal stress or with a change in family routine. This may be when guests are visiting during the holidays or when returning to work. It's not always easy to tell the difference between a breast infection and a plugged duct. They have similar symptoms and one can progress into the other. The breast is made of a series of milk-making lobes at the back that funnel down through ducts to the nipple at the front. And any inflammation or swelling of the breast may result in inflammatory mastitis. This can progress to an infection and result in bacterial mastitis if not treated in a timely manner. This can then progress to breast milk phlegm or abscess, especially if you're using aggressive breast massage or incorrectly using your pump and causing trauma to the breast. Regardless of why it started, the diagnosis of mastitis is generally made by your symptoms. It's characterized by localized one-sided breast tenderness and redness, accompanied by a fever of 101 degrees or greater, and you may start to feel fatigued or symptoms of the flu, like chills, nausea, vomiting, body aches, and a headache. The breast will also often have a red wedge-shaped area of redness, accompanied by breast fullness and tenderness in that same spot. Risk factors for mastitis include anytime you've previously had mastitis while breastfeeding, sore or cracked nipples, although mastitis can come without any damage to the actual nipple, a tight-fitted bra, or anytime there's pressure that's put on the breast, so wearing a seatbelt that's too tight or having a backpack on where the strap is constricting the breast, baby wearing with an improperly fit baby carrier, carrying a sleeping baby on your chest can all result in too much pressure and inflammation resulting in that breast. If you have breast implants where milk can't move equally out of the breast and back through the lymphatic system, this can also increase the risk of mastitis. Shallow latch and a tongue-tie baby where milk is not efficiently moving out of the breast can also result in mastitis. Being overly stressed or tired, having poor nutrition, smoking, very large breasts where again milk flow is being restricted, or having a history of breast surgery can also make you more prone to mastitis. If you already feel like you have mastitis, there are recommendations that we would generally make to every person. I don't recommend just immediately necessarily jumping to antibiotics unless it's absolutely necessary. If you feel you're at the beginning stages of plug ducts, please see my other video on plug ducts for how to address and manage those. Once you feel like you're in active mastitis, the most important things to remember are to frequently be moving milk, but trying not to stimulate an oversupply. An oversupply caused by too much pumping can actually increase pressure and inflammation in the breast, which is what we're trying to reduce. So in general, you want to just feed your baby and pump to your normal routine without trying to stimulate an oversupply. The more milk you move, the more milk you make. So you want to be very careful to not be over pumping when trying to get rid of a plug duct or mastitis. You want to, when possible, be feeding and efficiently feeding baby as opposed to a pump. Now, if you're exclusively pumping, if you're working and have to pump, you do want to make sure that you have a quality pump with the right size flange. If the reason you're getting recurrent plug ducts and then mastitis is because of the wrong kind of pump, from an inefficient pump that doesn't move milk well for you, or from a pump flange that's the wrong size, you want to make sure that you're addressing that first to prevent the plugs and mastitis from happening again. You also, when you're in mastitis, we used to say use heat on the breast and massage to really try to work those plugs out to get milk to move. But we now find that mastitis and plug ducts are caused by inflammation in the breast. So we want to avoid really aggressive heat, Some gentle heat before feeding and pumping can feel good if it will help move milk, but in general, we don't want to use excessive heat where we're furthering inflammation and preventing milk from moving. And we actually want to be using ice after feeding. So you would want to do just very gentle massage on the breast. You want to think of it like a combing action, encouraging milk to flow to the baby, encouraging milk to move to a pump, and then use ice afterwards. You can use, there's all kinds of different breast products that you put in the freezer. Having a gentle cold ice on that will help reduce inflammation. You can also safely take ibuprofen to help reduce inflammation and swelling in that breast. So old guidelines recommended using heat during mastitis. New guidelines recommend very gentle massage. Do not be aggressive on that breast tissue where you're increasing inflammation, and be using ice after feeding. Ice will not drop your supply if you're moving milk. I know a big concern of a lot of people using ice is they think it's going to wean their supply. As long as you're routinely moving milk, it won't reduce your milk supply, but it will reduce the inflammation. We also want to make sure that that microbiome of the breast is as healthy and balanced as possible. So we found that if you consider taking a quality probiotic, specifically with the strains Lactobacillus fermentum and Lactobacillus salivarius, these two strains of probiotics actually benefit the breast microbiome to help reduce that inflammation and restore balance to the system of the breast. So consider taking those strains of probiotics. Doing a liquid form of those probiotics that are refrigerated will give you the maximum potency of those live strains of probiotics for helping return your breast to gut health. Now, if you've tried all of those things, those are the general recommendations. Do all of those things first. Gentle massage, feed routinely, make sure that those breasts are being having milk moved routinely, ibuprofen, ice, probiotics. If you're still finding that you're having a fever of 100 degrees or greater, or those symptoms are not going away, if it's been more than a day with those symptoms, you may want to consider going to your primary care physician or an OB for antibiotic use. We want to try to limit use of those antibiotics when possible. So try to find the trigger of the mastitis or the plug duct first and have that as always addressed. And if you need to, as a result, then go on antibiotics. You do also want to, if you have any milk blebs, those are the little white spots on the tip of the nipples, you want to address those. If you're having any oversupply hyperlactation, that can strain the system and increase inflammation. So if you have an oversupply, you'll want to work with a lactation consultant to bring that supply down to, again, resolve the mastitis and hopefully prevent it from happening again. If you're continuing to have recurrent mastitis, something else is going on. We should not be having recurrent mastitis. Usually that's from undiagnosed tongue tie, an inefficient pump, or the wrong size pump flange. If you're pumping with a flange that's too big, it's actually going to swell the areola around the nipple and not let milk move efficiently. So it's very important that you have the correct size flange. If you have a larger breast or an implant, doing lymphatic drainage massage can also be helpful. I'm going to now show you a couple of those techniques. So the most simplest way is Maya Bowman's breast gymnastics. So you're literally just going to take the breast before you feed or pump or anytime it feels full, and you're gently going to lift up and down and up and down and side to side, very gently, and then around in circles clockwise and counterclockwise. That can be done anytime that your breast is feeling full to help milk move through. You can also do a gentle lymphatic drainage massage, and you can see my other video on how to do that technique. I hope that helps. Happy feeding.